Hi. Hi, Ben. How are we doing
Pete.
today?
I'm well, thank you. Yourself?
I'm very good. So I'm delighted to announce Ben is one of our keynote speakers on the Health and Wellness Day at Gamification Europe 2020. And we're having this quick interview with Ben, find out a bit more about him and what you can look forwards to. So Ben, give us a little bit of insight into who you are, what you do.
Sure. So I'm Ben. I'm the founder and CEO of Good Boost, which is a social enterprise that we work in digital exercise program for people with musculoskeletal conditions, which is essentially an umbrella term for things like arthritis, back pain, and other more complex inflammatory pain conditions. My background is I'm a registered osteopath. I did a research MSc at Oxford University in musculoskeletal science, published a few papers around exercise rehab, community, MSK, peer support. I'm also an MSK clinical champion for Versa Arthritis and a fellow for the Winston Churchill Foundation, where my research focuses on the gamification of musculoskeletal exercise, most notably for people who are over the age of 55.
Fantastic. So you're researching it, and also very practical. I mean, how many people would you say you're affecting, helping with your gamified work?
In the UK to date, in the past few years, we're into the few thousand now that we've been supporting. I think what's been really interesting is that it's not just a tokenistic, a superficial engagement with what we do. People transform their lives. That people cancel their hip and knee replacement surgery. People stop taking medication for their condition. So we're only in the few thousand, but those few thousand we've supported, we've helped to a very deep level.
That's cool. Now, I'm very excited about the title of your talk at the conference, Arthritis Memes Business. Can you, without giving away the whole topic, can you give us a little bit more insight into what people can expect from your talk?
Yeah, so the talk title itself is a play on words. So rather than Arthritis Memes Business, it's Arthritis Memes Business. And if people don't know what a meme is a comedic representation of a point or a thing that started in the early 1910s as a way to, through a picture and some quotes or some words, to create some sort of comic snap engagement piece. And it's become a comical form in its own right, as a medium to create laughs and to engage people. And there are websites that are dedicated to memes, which is essentially people creating memes and sharing them, whether they're related to political or kind of current affairs or just completely random. And meme culture has changed over the years. The point being is about comedy and about making people laugh. And so the key thing about health conditions and self-management of health condition is about creating behaviors. And if people don't enjoy the experience, they're not going to engage with that self-management behavior and activity. And so Arthritis Memes Business is all about how we've used focus groups to understand what our users are looking for and how they're looking for emotional support, humor, an enjoyable experience, not just having high expertise and clinical knowledge and programs. It's about making sure that it's fun, enjoyable, and how we apply both humor, such as memes, and gamification principles to keep people engaged, because our competitors in the health realm are not other health apps. It's other apps that are vying for our attention. Facebook, Netflix, Instagram. The moment these apps win and they take people's attention away from their disposable time being spent on their health management and self-management through healthy behaviors. So in order to tackle that, health apps need to be as addictive as engaging as other apps that are around social fun.
That's a really good point. I like that. We've got to be more fun than the things people see most fun. Wow. Exactly. No challenge there. That sounds like a good challenge for gamification, to be honest. So in terms of conferences and gamification, have you been to any gamification conferences before? What's your experience of finding out about the latest thinking in the industry?
So no, this is the first time I ever attended one, and as a result, also the first time I've ever spoken at one. So really looking forward to it.
That's cool. And we've released the names and details of a few speakers and talks now. Are there any that have caught your eye that you're particularly looking forward to?
No, I can't remember. Sorry, I cannot list
caught you on the hot. I will flag some up for people. I mean, across the 5 days, is there a particular day that catches your interest? Obviously, you're speaking on the Health and Wellness Day, but we're starting with a Learning and Education Day. We've also got Communities Day, which I also think you should be quite interested in because you've got groups of people you're working with. And then there's the Marketing and Loyalty Day, ending with the Employee Engagement Day, which is the one we've got the most talks lined up for already, actually. It seems to be a very popular topic.
So no, without that is the communities and the health and wellbeing days, which are most, and as you rightly say, Pete, is the key to health and wellbeing apps is also about creating communities through those apps. The moment there's something that's more meaningful than just your interaction with the app, the moment you're interacting with a health app, that's interacting with other people, and that's your rationale for engaging and being part of that community, that's where you see much more repetitive behaviors happen. So really interested in that area too.
That's perfect. Well, thanks very much for a little insight into what we can expect from you. And thank you very much for taking part in this little interview.
Thank
Cheers.
you very much, Pete. Looking forward to it.